Almost everyone experiences back pain at some point in their lives. Usually, we blame it on a bad mattress, lifting something heavy, poor posture, or a sports injury. This is often what we call mechanical back pain. It typically gets worse with certain movements and may improve with rest. But what if your back pain behaves differently? What if resting actually makes you feel worse? What if you wake up feeling extremely stiff, and movement gradually helps you loosen up? And what if your back pain started before the age of 40? Today we're talking about inflammatory back pain, or IBP. Inflammatory back pain is a specific pattern of back pain that can be associated with inflammatory conditions such as axial spondyloarthritis, including ankylosing spondylitis. Recognizing the pattern early can help you seek the right assessment and treatment. Let's break it down. First, let's look at 5 important features that can suggest inflammatory back pain. Number 1, age of onset. Inflammatory back pain commonly begins before the age of 40. Number 2, duration. The pain usually persists for at least 3 months, rather than being a short-term episode that settles within days or weeks. Number 3, the onset is usually gradual. There may not be one specific injury or event that caused the pain. Instead, it tends to develop slowly over time. Number 4, morning stiffness that improves with movement. This is one of the important clues. You may wake up feeling very stiff, and it can take some time before your back starts to loosen. Movement or exercise may make you feel better, while prolonged rest or sitting still may make your symptoms worse. Number 5, the location and pattern of the pain. Inflammatory back pain commonly affects the lower back and the sacroiliac region, where the spine connects with the pelvis. Some people experience alternating buttock pain, where the discomfort moves from one side to the other. Now, having one or two of these features does not automatically mean that you have inflammatory back pain. However, if several of these features sound familiar, it is worth discussing your symptoms with a healthcare professional. So, what is actually happening inside the body? Unlike a simple muscle strain, inflammatory back pain is associated with inflammation driven by the immune system. In conditions such as axial spondyloarthritis, inflammation can affect structures around the spine and sacroiliac joints. Several inflammatory pathways are involved, including tumor necrosis factor, or TNF, and interleukin-17, also known as IL-17. Over time, persistent inflammation can contribute to changes in the bone and joints. The body may produce new bone as part of this process. In advanced disease, this can contribute to the formation of bridges between vertebrae and, in some cases, spinal fusion. This is one reason why recognizing symptoms early is important. Diagnosis is not based on one test alone. Healthcare professionals consider your symptoms, medical history, physical examination, blood tests, and imaging together. Blood tests may include markers of inflammation such as CRP and ESR. You may also hear about HLA-B27. HLA-B27 is a genetic marker associated with a higher likelihood of certain spondyloarthropathies. However, having HLA-B27 does not mean that you definitely have the condition. And importantly, you can have axial spondyloarthritis without being HLA-B27 positive. A physical examination may also be performed. Your clinician may assess spinal movement, hip movement, posture, and other relevant features. You may also hear about tests such as the Schober test, which can be used to assess lumbar spine movement. Now let's talk about management. The good news is that there are effective treatments for inflammatory conditions that cause back pain. Management usually involves a combination of exercise, education, lifestyle approaches, and medication when appropriate. Exercise and physiotherapy are important parts of management. Regular movement can help maintain spinal mobility, strength, physical function, and overall quality of life. Your physiotherapist can help develop an exercise program that is appropriate for your symptoms and abilities. Lifestyle factors are also important. For example, if you smoke, stopping smoking can be beneficial for your overall health and may be particularly important in inflammatory rheumatic disease. Medication may also be prescribed. Non-steroidal anti-inflammatory drugs, or NSAIDs, are commonly used to help control pain and inflammation. If symptoms remain active despite appropriate treatment, specialist medicines such as biologic therapies may be considered. These can include TNF inhibitors and IL-17 inhibitors. The exact treatment depends on the individual, the diagnosis, disease activity, other health factors, and response to previous treatments. Early recognition can help you receive appropriate assessment and treatment. And remember, this video is for educational purposes only. It does not replace personalized medical advice or a clinical assessment. If you found this video helpful, like the video, subscribe to Dr. Momo Pain Explained, and let me know in the comments what pain or physiotherapy topic you'd like me to explain next. Thanks for watching, and stay healthy.